Good afternoon, BSN2F. We are Group 1 and we will report first aid. For the objectives, we have 1. Definition of terms. 2. State the importance and aims and hindrances to first aid. 3. Cite the roles and characteristics of a first aider. 4. Explain the different principles involved in first aid. 5. Enumerate the different guidelines in performing first aid. 6. Discuss the nursing interventions for some medical emergencies. 7. Show materials needed for first aid. And 8. Perform beginning skills in bandaging and splinting. I am Maxime Nicole Pares Tabarada and I will be the reporter for definition of terms. First, accidents. These are unplanned or unwanted events that result in injury, property damage, or loss of life. In the picture, we have a motor vehicle accident that needs immediate health care or first aid. Second, bandaging. This is the process of covering a wound or an injured part. Its uses may be to prevent contamination of wounds by holding dressings in position, to provide support to a body part, to provide rest to an injured part, and to prevent and control hemorrhage. So we have different types of bandages. These may include triangular bandages, crepe bandage, gauze or cotton bandage, and adhesive bandage. We also have different methods of applying bandages. It may be circular, spiral, reverse spiral, or figure of 8 for the different parts of the injured body part. Number 3, bites. These are wounds or swelling pain received from the teeth of an animal, insect, or humans. Burns. These are injuries to the skin and to other body tissues that are caused by excessive heat, chemicals, electricity, or radiation. It may be classified according to their depth. We have partial thickness burns, first-degree burns, and second-degree burns. For the first-degree burns, it only involves the epidermis and are red and painful. For the second-degree burns, they damage both the epidermis and the dermis. While for the full-thickness burns, we have the third-degree burns. It damages the epidermis and the dermis. It may also be classified according to its types. So we may classify them as friction burns, cold burns, thermal burns, radiation burns, chemical burns, and electrical burns. Dislocation. It is basically the displacement of a bone from its normal position. It occurs when the end of one bone is pulled out of the socket in a ball and socket, ellipsoid, or pivot joint wherein the ends of the bones are forced from their normal positions. Most dislocations occur in stretching of the joint capsule. Emergency care. This is an episodic and crisis-oriented care. So it may be either temporary or a life-saving measure that is rendered without delay and is provided to victims with serious or potentially life-threatening injuries or illness. Fainting. This is a partial or complete loss of consciousness resulting from a temporary reduction of blood flow to the brain. Signs and symptoms may include lightheadedness or dizziness, signs of shock such as pale, cool, or moist skin, nausea, and numbness or tingling in the fingers and toes. First aid management. Position the victim on his or her back. Keep the victim in a lying position. Loosen any restrictive clothing. Check for any other life-threatening and non-life-threatening conditions. And it is important that you will not give the victim anything to eat or drink. What is first aid? This is the act of providing immediate help to a sick or injured person until professional medical help arrives or becomes available. So its aim is to stabilize the patient while further emergency care is sought. Its limitations is that it does not imply medical treatment and is by no means a replacement for it. So its objectives are to preserve life, prevent further harm and complication, seek immediate medical help, and provide reassurance. Frostbite. This is a tissue injury caused by exposure to extreme cold or by contact with extremely cold objects. The extreme cold causes peripheral vasoconstriction, cutting off the oxygen supply to surrounding cells. Hematoma. We may refer to this as bruises. This is a collection of blood outside of a blood vessel that gives the skin a spongy, rubbery, and lumpy feel. Hemorrhage care. This is the act of providing care and treatment in order to manage bleeding. Techniques involve direct pressure and pressure bandaging. Infarction. When a blood clot or thrombus suddenly blocks a coronary blood vessel, a heart attack occurs. The area that has been cut off from its blood supply suffers from the lack of oxygen and nutrients. Thus, it dies if the blood supply is not quickly established. The region of dead heart tissue is called an infarct or myocardial infarction. So look for signs and symptoms such as chest pain, discomfort, or pressure. Pain may be associated from discomfort to unbearable crushing sensation in the chest. Injuries. These are damages or harm caused to the structure or function of the body by an external agent or force. Types. We have mechanical injury, thermal injury, electrical injury, and injury produced by ionizing radiation. Critical injuries involve head injury, concussion, and spinal injury. So there are ways to prevent these types of injuries in the head, neck, and back. So practice safety guidelines such as wearing safety seat belts, wear approved helmets, eyewear, face guards, and mouth guards, climb steps carefully, obey rules in sports and recreational activities, avoid inappropriate alcohol use, inspect work and recreational equipment regularly, and think and talk about safety always. Joints. They are commonly referred to as articulations. They are named according to the bones or portions of the bones that join together. For example, we have the temporomandibular joint, which is located between the temporal bone and the mandible. So they are classified structurally. We have the fibrous joints, cartilaginous joints, and synovial. So for the fibrous joints, they are articulating surfaces of two bones that is united by the fibrous connective tissues. They are also subdivided into sutures, syndesmosis, and gymphosis. Next, we have the cartilaginous joints. They are united by means of cartilage. And lastly, we have the synovial joints. These are freely movable joints that contain fluid in a cavity surrounding the ends of articulating bones. So they are also classified according to the degree of motion. We have synarthrosis, which are non-movable, amphiarthrosis, which is slightly movable, and diarthrosis, which is fully movable. So fibrous and cartilaginous joints have little or no movement, while synovial joints have considerable movement. Poisoning. This happens when a person inhales, ingests, injects, or absorbs substances that are harmful to the body. Children younger than 6 years of age are at higher risk for ingesting pharmaceutical agents. So these are more common to children. Examples include acetaminophen poisoning, which is an OTC medication that is frequently involved in childhood poisoning. Other poisoning includes caustic poisoning, which is the ingestion of a strong alkali, iron poisoning, which is frequently swallowed by small children because of the active ingredient in vitamin preparations, and lead poisoning. Seizures. This is an involuntary contraction of the muscle caused by the abnormal electrical brain discharges. They are characterized by sudden, brief attacks of altered consciousness, motor activity, and sensory phenomena. So the term seizure is often used interchangeably with convulsion. There are types and causes of seizures that vary with age and are classified into two major categories. We have the partial and generalized seizures. With partial seizures, only one area of the brain is involved. With generalized seizures, the disturbance appears to involve the entire brain. Loss of consciousness usually occurs. So we have 3 seizure phases and its signs and symptoms. First, for the beginning phase, we have the prodromal stage and the aura. For the prodromal stage, signs and symptoms include mood changes, anxiety, feeling lightheaded, difficulty sleeping, difficulty staying focused, and behavioral changes. Aura includes odd smells, sounds or taste, dizziness, vision difficulties, numbness, nausea, headache, panic, and feelings of intense fear. For the middle phase, we refer to it as the ictal phase. Loss of awareness, memory lapse, feeling confused, difficulty hearing, odd smells, sounds or taste, difficulty speaking or saying strange words, twitching, loss of muscle control, repeated movements such as lip smacking, body convulsions, a racing heart, and trouble breathing. The last phase is what we call the post-ictal phase. It includes confusion, lack of consciousness, tiredness, exhaustion, headache, loss of bladder control, fear and anxiety, frustration, shame or embarrassment, thirst, nausea, sore muscles, weakness in the parts of the body, and injury. Shock. This is a condition that occurs due to poor circulation to the vital organs. It is very serious and life-threatening. Causes may be due to dilated blood vessels, bleeding, and severe dehydration that leads to a drop in the blood pressure resulting to poor circulation. Splinting. This is the use of a supportive device in order to support or immobilize the fractured bone. The types of splint includes rigid splint, the flexible splint, and the soft splint. Sprain. This is a ligament injury. This happens when the bones of a joint are forcefully pulled apart and the ligaments around the joint are pulled or torn. On the other hand, strain is a muscle tendon injury. Both the sprain and the strain are very painful injuries. Tourniquet. This is a device used to control venous and arterial circulation for a period of time by forcibly compressing blood vessels, as a bandage tightened by twisting. We may be able to improvise tourniquet by using materials such as folded handkerchief, folded strip of clothing, necktie, scarves, bandanas, nylon webbing, and an ace bandage. Trauma. This is used to describe an injury to living tissues caused by an external agent. Wounds. So we have the closed wound and the open wound. So first, let's differentiate the closed wound. A wound where the outer layer of the skin and mucous membrane is intact and the damage lies below the surface. Examples are hematoma and the fracture. Open wound. This is a wound wherein the outer layer of the skin is broken. The break in the skin can be as minor as the scrape of the surface layers or as severe as a deep penetration. We have abrasion. This is caused by the skin rubbing against a rough surface, which is likely to occur on the elbows, knees, shins, and upper extremities. Next, we have the laceration. These are the deep cuts or tearing of your skin. Accidents such as with knives, tools, and machinery are frequent causes of such wound. Next, we have puncture. This is a deep wound that occurs due to something sharp and pointed, such as a nail. The opening on the skin is small and the puncture wound may not bleed as much. Next, we have amputation. This is the cutting or the tearing off of a body part. And lastly is the avulsion. An avulsion is a partial or complete tearing away of the skin and the tissue beneath. This usually occurs during violent accidents, explosions, and gunshots.
Good day, everyone. This is me, Physiology, and I'm going to report CLO number 2. State the importance and aims and hindrances to first aid. Importance of first aid. It affords people with the ability to provide help during various emergency situations. A person knowledgeable in first aid becomes more than just another bystander. Instead, they become an invaluable support not only to victims, but also to professional emergency responders and medical practitioners in situations such as someone ingests a harmful substance, suffers from a heart attack, a seizure or stroke, involved in a motor vehicle accident, or is caught in a natural disaster. A person trained and knowledgeable in even the very basics of first aid can be of extreme importance in assisting the injured person until emergency responders arrive. First aid helps ensure that the right methods of administering medical assistance are provided. Knowing how to help a person is just as important in emergency situations. It only takes 6 minutes for the human brain to expire due to lack of oxygen. As such, ineptitude and misinformation will not be of much help to a person in need of medical assistance. Knowledge in first aid also benefits the individuals themselves. Whether the emergency affects themselves directly or involves people they live and work with, first aid stems the severity of an emergency in a given time and place. Aims of first aid. First aid is the immediate treatment or care given to someone suffering from an injury or illness until more advanced care access or they recover. Aims. Preserve life. Preserving life is the primary aim, and it involves making sure that an injury is not life-threatening. Prevent injuries from getting worse. To avoid injuries from getting worse, a first aider should not move the patient if they are bleeding or have a fracture. Relieve pain. First aid must be reduce suffering at all costs by making patients as comfortable as possible. Promote recovery. This is the practice of helping a person heal their wounds in the short and long term. And lastly, protect the unconscious. Unconscious persons are the most vulnerable and they need extra protection. Hindrances of first aid. Number 1. Unfavorable surroundings. Examples are nighttime, crowded city streets, churches, shopping malls, busy highways, cold and rainy weather, lack of necessary materials or helpers. Number 2. The presence of crowds. Crowds curiously watch, sometimes heckle, sometimes offer incorrect advice. They may demand haste in transportation or attempt other improper procedures. A good examination is difficult while a crowd looks on. Number 3. Pressure from victim or relatives. The victim usually welcomes help, but if he is drunk, he is often hard to examine and handle, and is often misleading in his responses.
Good day, everyone. I'm Yutanko Maria Justine Leiby. I'm going to report CLO number 3, cite the roles and characteristics of a first aider. First aid is the help given to someone who is injured or ill to keep them safe and to cause no further harm. The role of a first aider is to give someone this help. Assess the situation quickly and calmly. So first, assess for safety. Check whether you or the casualty are in any danger. Is it safe to approach them? Make sure that performing first aid isn't going to be hazardous to your health. Second, assess for scene. Find out what caused the accident or situation and how many casualties there are. Third, assess for situation. Find out what's happened, how many people are involved, and how old they are. Are there any children or elderly? So, in short, assessing the situation makes you sure you aren't in any danger before you start first aid. Protect yourself and them from any danger. You should always protect yourself first, never put yourself at risk, and you won't be much help if you get injured too. Only move the casualty if leaving them would cause more harm, because moving the casualty unnecessarily may cause further injuries. And if you are unable to make an area safe, call for emergency help. Prevent infection between you and them. Every first aider needs to take precautions with all first aid situations. To decrease the risk of cross infection, wash your hands with soap and water or rub your hands with alcohol gel. Wear disposable latex-free gloves. Do not touch an opened wound without gloves on. If you do not have any gloves, you could use clean plastic bags or ask the casualty to dress the wound if they are able. And lastly, do not breathe, cough, or sneeze over a wound or a casualty. Comfort and reassure. Stay calm and take charge of the situation. Introduce yourself to them to help gain their trust. Explain the situation and everything you're going to do before you do it. Provide information that is comforting and instills trust and confidence in your abilities to provide first aid care. Treat the casualty with dignity and respect at all times. So cover up any exposed body parts with a blanket or sheet and having crowd control if possible. Assess the casualty and give first aid treatment. If there's more than one casualty, make sure you help those with life-threatening conditions first. Use the primary survey to deal with life-threatening conditions. When these have been dealt with successfully, move on to the secondary survey. So a primary survey is a quick way to find out how to treat any life-threatening conditions a casualty may have in order of priority, while a secondary survey is a methodical check to assess a responsive casualty for any injuries or illnesses. Arrange for help if needed. So you need to determine if the accident warrants a visit to hospital or simply a cleansing and a band-aid. So you need to check those important ABCs: airways open, breathing restored, and circulation maintained. And if not, or if you think it's serious, then you should call for an ambulance or help. There are a whole range of skills that are beneficial for a first aider to have in order to deal with situations in the best way possible. These are some characteristics or qualities of a good first aider. Communication skills. If you are able to communicate effectively with the injured person, they will be much more likely to trust you and feel reassured. You will calm their sense of panic and make the situation a lot easier for you both. Having strong communication skills is also advantageous should you have to relay important information to the emergency services. The ability to work under pressure. The demands of a first aider can range anywhere from something simple, like a cut finger, to something a lot more serious, like a cardiac arrest. As a first aider, you must be prepared for all possibilities and know how to react quickly to the situation. You must keep calm, as panicking will only make the situation worse, and be able to work effectively under pressure. Initiative and leadership. In an emergency, time can often play a crucial part in the outcome. You may have to take on a leadership role or take command of a potentially volatile situation. So, being able to act quickly, take the lead, use your initiative, and trust your judgment are all vital skills. You may also have to organize bystanders to assist in various tasks. Also, in a complex emergency scenario, it takes initiative to assess the situation and quickly come up with a plan. The ability to work in a team. As well as being able to lead, it is important that you can work effectively in a team. So, a first aider should be an integral team player because you may have to work alongside the emergency services, and being able to cooperate with them is vital. Positivity. A person who believes that there can be a positive outcome, no matter hurdles lie ahead, is far more likely to come to a person's aid in what looks like a dire situation. These types of people also have a strong belief in their ability to tackle challenges and beat the odds. Positivity will help you reassure the injured person and prevent yourself from quickly becoming mentally drained while on the job.
Good morning, everyone. This is Miss Papa, and I will be reporting CLO number 4. Explain the different principles involved in first aid. Anatomy and physiology. Knowing the structures in our body will help us understand how certain conditions may present and how treatment may help the victims. It is important to have some understanding of the anatomy and physiology process of the human body so we can understand how certain conditions may present and how our treatment may help victims. Body mechanics. Proper body mechanics refers to the best way to use our body to move or lift a patient. Following a proper body mechanics prevents injuries, especially upon performing a procedure. Microbiology. Proper washing of your hands and sanitizing and using clean gloves prior to cleaning or dressing a wound to prevent spreading of infections and contamination. Having a clean hands before touching the wound is essential to help avoid infection and prevent cross-contamination of existing wounds. Pharmacology. There are procedures in first aid that involve using cleaning agents, That, as a first aider, must know its benefits and must be applied appropriately and used correctly, like using povidone iodine or betadine for treatment and prevention of wound infection. Psychology. Communicating with bystanders to reduce anxiety and emergency services personnel to inform the situation or ask for immediate help. This is to promote safety, stabilize survivors, and connect individuals to help and resources. Sociology. It is also necessary to build trust and rapport with your client to provide comfort and maintain a healthy nurse-client relationship. Establish rapport towards the client to gain cooperation or participation upon doing a procedure. Chemistry. It is important to have a background knowledge on different chemical solutions that will be applied on treating the infected site and be aware of possible causes of skin burns or skin complications. Physics. Applying the procedure for RICE or rest, ice, compress, and elevate in order to restore appropriate strength and stability exercises to minimize the risk of the injury site. Applying pressure to the wound can stop or prevent it from bleeding, and wiping it thoroughly can eliminate microorganisms. Time and energy. All the necessary materials inside your first aid kits will be used for your emergency cases must be prepared and properly secured all times. Safety and security. Protect the individual from possible harm from bystanders and surroundings and secure the emergency site to reduce further harm to the casualty. So consider safety areas where to perform the procedure and acquire knowledge in identifying safety areas in the body of the client upon performing an intervention.
Good day, everyone. I am Mr. Joe, and I will be reporting CLO number 5. Enumerate the different guidelines in performing first aid. So, number 1. Before administering care to an ill or injured person, check the scene and the person. Size up the scene and form an initial impression. So, pause and look at the scene before responding. Is the scene safe to enter? So look around and make sure that performing first aid isn't going to be hazardous to your health. Like, are there any exposed wires near the injured person? Are there toxic fumes or flames? In short, make sure you aren't in any danger before you start first aid. You won't be much help if you get injured too. If you are unable to make an area safe, call 911 for emergency help. So next, what happened? If possible, ask the injured person what happened. Can she speak? Can he or she tell you how serious the accident is? Next, how many people are involved? If there are multiple casualties, you must help those with life-threatening injuries or conditions first. Next, what is my initial impression about the nature of the person's illness or injury? Does the person have any life-threatening conditions, such as severe, life-threatening bleeding? Give first aid treatment, such as CPR or applying pressure to bleeding wounds. Life-threatening injuries and conditions must be prioritized before giving treatment to less serious cases. Next, is anyone else available to help? So always shout for help. Don't be afraid to shout for help as soon as you begin first aid measures. Keep shouting for help until you know you've been heard and action has been taken. Professional help can't come soon enough if it's needed. Arrange arrange for the right kind of help. Call 911 for an ambulance if it's serious, or take or send them to a hospital if it's serious but unlikely to get any worse. Number 2, if the person is awake and responsive and there is no severe life-threatening bleeding. So obtain consent. Tell the person your name, describe type and level of training. State what you think is wrong and what you plan to do, and ask permission to provide care. Tell a bystander to get the AED and the first aid kit. point to a bystander, and speak out loud. AED stands for Automated External Defibrillator. Next, use appropriate PPE or personal protective equipment. Put on gloves if available. PPE is what will protect you against any hazardous condition. It is important because it prepares you for any health and safety risks and gives you extra protection. Next, interview the person. Use sample questions to gather more information. SAMPLE stands for S, signs and symptoms, A, allergies, M, medications, P, pertinent medical history, L, last food or drink, and E, events leading up to the incident. So sample questions are designed to help a responder to gather invaluable information from breathing conscious patients to pass to professional medical responders, not to diagnose medical problems. Next, conduct a head-to-toe check. Check head and neck, shoulders, chest and abdomen, hips, legs and feet, arms and hands for signs of injury. The head-to-toe check is used as part of the secondary assessment to help establish if any injuries are present on the casualty's body. So next, provide care consistent with knowledge and training according to the conditions you find. Knowledge of first aid promotes the sense of safety and well-being amongst people, prompting them to be more alert and safe in the surroundings they dwell in. Number 3. If the person appears unresponsive, shout to get the person's attention using the person's name if it is known. If there is no response, tap the person's shoulder if the person is a child or adult, or the bottom of the person's foot if the person is an infant, and shout again, while check for normal breathing. Check for responsiveness and breathing for no more than 5 to 10 seconds. This ensures that the correct priority is given to your call. You should summon an ambulance in either case if the patient is unconscious. After opening the victim's airway, check to see if the victim is breathing. Look to see if their chest is rising and falling. Listen over their mouth and nose for breathing sounds. Feel their breath against your cheek for 10 seconds. Never give an injured, unconscious person anything by mouth. This means no pills, no liquids, nothing. When a person is unconscious, even water can interfere with breathing and it may choke him or her. Number 4. If the person is breathing, send someone to call the designated emergency number and obtain an AED and first aid kit. Proceed with gathering information from bystanders using the sample questions. Next, conduct a head-to-toe check. The head-to-toe assessment includes all the body systems and the findings will inform the overall condition. Next, roll the person onto his or her side into a recovery position if there are no obvious signs of injury. Putting someone in the recovery position will keep their airway clear and open. It also ensures that any vomit or fluid won't cause them to choke. Number 5. If the person is not breathing, send someone to call the designated emergency number and obtain an AED and a first aid kit. Ensure that the person is face up on a firm, flat surface, such as the floor or the ground. Moving an injured person can cause additional injury and pain, and may complicate the victim's recovery. Next, begin CPR. Start with compressions, or use an AED if one is immediately available. If you are trained in giving CPR and using an AED, continue administering CPR until the person exhibits signs of life, such as breathing, an AED becomes available, or EMS or trained medical responders arrive on scene. Always take note. End CPR if the scene becomes unsafe or you cannot continue due to exhaustion.
Good day, everyone. My name is Basala Denicacate, and I'm the reporter for CLO number 6. discuss the nursing interventions for some medical emergencies. So the first medical emergency that we have is EPISTAXIS, or commonly known as nosebleed. First things first, you must tell the patient to relax, sit upright, and lean his or her body and head slightly forward. This will keep the blood from running down the patient's throat, which can cause nausea, vomiting, and diarrhea. Do not let the patient lay flat or put his or her head between his or her legs. Then, instruct the patient to breathe through his or her mouth. This will allow the patient to have a supply of oxygen, since the nose is being blocked. Then, use a tissue or damp washcloth to catch the blood. This will allow you to prevent spillage. Then, if the patient is old enough, explain to the patient that he or she must use his or her thumb and index finger to pinch together the soft part of his or her nose. However, if the patient is too young, such as a child, you may do so for him or her. While doing so, you must make sure that the soft part of the nose is being pinched against the hard bony ridge that forms the bridge of the nose. Again, make sure that the soft part of the nose is being pinched against the hard bony ridge that forms the bridge of the nose. Because if you squeeze at or above the bony part of the nose, it will not put pressure where it can help stop the bleeding. So you may try and palpate your nose right now. You feel for the soft part and the bony ridge that forms the bridge of the nose. So have you felt it? Good. Moving onwards, the patient must keep pinching his or her nose continuously for at least 5 minutes before checking if the bleeding has stopped. It is our job as a nurse to inform the patient when enough time has passed. This is most especially important if the patient has no wristwatch or there is no wall clock within the vicinity. Then, if his or her nose is still bleeding, instruct the patient to continue squeezing the nose for at least another 10 minutes. And, depending on the patient's preference, the nurse may apply an ice pack to the bridge of his or her nose to further help constrict blood vessels, which will slow down the bleeding and provide comfort as well. This is not an unnecessary step, however, but it can aid in the healing process. Lastly, after the bleeding stops, advise the patient to refrain from bending over, straining, and or lifting anything heavy. You must also inform him or her to avoid blowing or rubbing his or her nose for several days. The next set of nursing interventions that we'll be talking about is focused on animal bites, whether it may come from snakes, dogs, or any other rabid animal. So the treatment of animal bites involves several factors such as the location of the bite, where the part of your body which you were bitten, then the overall health condition of the bitten patient, maybe old, young, pregnant, or maybe even immunocompromised. And lastly, whether or not the animal who bit the patient is vaccinated against rabies. Now, the main principles of care include early medical management, how fast the wound was tended to by professionals, irrigation and cleansing of the wound, which is important because irrigation can help clean the wound while avoiding trauma to the wound bed while minimizing the risk of driving bacteria further into the wound bed. Cleansing is to prevent infection. Next is the primary closure of the wound if it is low risk for developing infection. Then prophylactic antibiotics for high-risk wounds or people with immune deficiency. As I've said before earlier, it is one of the factors, the overall health condition of the bitten patient. Then rabies post-exposure treatment, depending on the dog, vaccination status or any other rabid animal vaccination status. And lastly, the administration of tetanus vaccine. That is to say, if the person has not yet been adequately vaccinated. So as for the treatment of bites from venomous animals such as snakes, at the time of a bite, the cornerstone of care is the complete immobilization of the affected body part. This is to prevent the faster spreading of the venom in the blood circulation. After which is the prompt transfer of the patient to a medical facility. So I've stated before in the main principles of care, it is the early medical management. So the sooner, the better. It is also important to remember that tourniquets and cutting wounds can worsen the effects of the venom, and it should not be treated as first aid. And frequently, victims of snake bites will require treatment with antivenom. It is important that the antivenom is appropriate for the snakes or other venomous animals that is endemic to the region. So now that we're done talking about the nursing interventions related to animal bites, let's now proceed to the nursing interventions related to open and closed wounds. First things first, apply direct pressure to any bleeding wound. This is to control hemorrhage. And take note that tourniquets are rarely indicated. Note, rarely indicated, since they may reduce tissue viability. And if you're wondering what viability means, it is the ability to survive or live successfully. Moving onwards, examine wounds for gross contamination, devitalized tissue, and foreign bodies. This is so that once you have identified them, they may be dealt with accordingly. Then, remove constricting rings or other jewelry from injured body part. And this is not only limited to jewelry but also constricting garments, such as tight t-shirts. And they must be removed because they can hinder blood flow. And hindering blood flow is equivalent to hindering the healing process. Afterwards, cleanse the wound periphery with soap and sterile water or any other available solutions. You may use betadine maybe or hydrogen peroxide and such. Those are only examples. And you may also provide anesthetics or analgesia whenever possible, as long as it's prescribed by a physician. Okay, so next is to irrigate wounds with saline solution using a large bore needle and syringe. And if ever that you find that they are unavailable, bottled water is also acceptable. Next is to leave contaminated wounds, bites, and punctures open. Wounds that are sutured in an unsterile environment or are not cleansed, irrigated, and debrided appropriately are at high risk for infection due to contamination. Note that wounds that are not closed primarily because of high risk of infection should be considered for delayed primary closure by experienced medical staff using sterile technique. Next is to clip hair close to the wound, if necessary. Note, however, that the shaving of hair is not necessary, and it may increase the chances of wound infection. Next is to cover wounds with dry dressing. Note that deeper wounds may require packing with saline-soaked gauze and subsequent coverage with a dry, bulky dressing. Next is to continue monitoring wound in case infections develop. Next is to follow tetanus prophylaxis guidelines for all wounded patients. And lastly is to follow tetanus prevention guidelines. This intervention, and the one I've said prior to this one, that both of which are related to tetanus, may depend on the hospital's protocols. So here we are now at the nursing interventions for burns. First is to assess wound status. Check the burn for size, color, odor, scar or scab, exudate, epithelial buds, which are small pearl-like clusters of cells on the wound surface, bleeding, granulation tissue, the status of graft take, healing of the donor site, and lastly, the condition of the surrounding skin. Afterwards, report any significant changes to the physician. Next is to support patient during distressing and painful wound care. Next is to coordinate complex aspects of wound care and dressing changes. Note that during the process of wound care, you must also frequently assess the pain and discomfort of the patient. You may administer analgesic agents and anxiolytic medications as prescribed before the pain becomes severe, because as you may have recalled in our pharmacology, some medications take time in order for their therapeutic effect to take place. Next is to assess and document the patient's response to medication and any other interventions. You may look for the side effects or adverse effects of the medication, and as for the interventions, if you have evaluated that they are not working appropriately for the patient, then you may switch to another intervention. Next is to teach the patient relaxation techniques. So since you're in pain, the patient is in pain, it may prove to be a very difficult time for them since they're continuously in discomfort. So you may provide frequent reassurance, use guided imagery and distraction to alter the patient's perceptions and responses to pain, hypnosis, music therapy, and virtual reality are also useful. Note that you must work quickly to complete treatments and dressing changes. Inform all members of the healthcare team of the latest wound care procedures in use for the patient. As it was discussed in our previous topics, documentation is important to ensure the continuity of care. Next is to assist, instruct, support, and encourage patient and family to take part in dressing changes in wound care. This is so when the patient is discharged from the hospital, you are encouraging independence. And early on, assess the strengths of patient and family in preparing for discharge and home care. This is so the significant others of the patient and the patient himself will be made aware of what are the things that he should continue doing and what are the things that he should improve in doing in order to promote health and healing. Okay, so now let us begin to discuss the nursing interventions of frostbite. Now, the main goal of emergency management for frostbite is the restoration of the normal body temperature. And I will discuss the treatment in the form of a mnemonic which I found during my research. The word is frostbite. So, F. F is for injuries in the lower extremities. Do not allow the patient to walk. Instead of letting the patient walk, move the patient from a cold area to a warmer place and shelter him or her from the cold. R stands for remove all constricting clothing and jewelries. And as I've stated in my previous interventions, these items may impair circulation. O stands for observe the patient for signs of hypothermia or lowered body temperature. And if you have observed that the patient does have these signs and symptoms, you must manage the condition accordingly and as swiftly as possible. S. Sterile dressings should be used. They should be used to wrap the affected part if immediate medical help is available before rushing the patient to the emergency department for further care. It is important for the nurse to remember to separate the fingers and toes in doing so. T. The extremity can be rewarmed using controlled and rapid rewarming. Rewarming first aid may be given in cases where immediate care is unavailable. To do this, the affected area is placed and soaked for 30 to 45 minutes in a 37 to 40 degrees Celsius whirlpool until the tips of the injured part flushes. The flush would indicate that the circulatory flow is reestablished. To aid the warming process, the water should be kept circulating. B. Be sure to conduct a physical assessment to observe for concomitant injury such as soft tissue injury, dehydration, alcohol coma, and fat embolism. If you're wondering what concomitant means, it means naturally occurring. I. In dressing frostbite injuries, it is essential to use strict aseptic technique. Damages from frostbite make the patient susceptible to infection. T. Tetanus prophylaxis can be given if there is associated trauma. E. Encourage hourly movement of the affected digits to promote maximal restoration of function and to prevent contractures. So here we are now at the nursing interventions for poisoning, whether it may be for irritants, narcotics, or corrosives. First is to assess for airway patency, breathing, and circulation, also known as the ABCs. Do this for all clients of whom accidental poisoning is suspected. Next is to remove any visible materials from areas such as the mouth and eyes to terminate exposure to the poisons. Then, identify the type and amount of substance ingested, that is, if it's possible, because this may help to determine the required antidote of the substance. Then, call the local poison control center before attempting any interventions. And if you're directed by a physician, give oral fluids to assist vomiting. If directed, save the vomitus for laboratory analysis. This may assist with further treatment of the client. Position the victim with the head to the side. This is to prevent the aspiration of vomitus and assist in keeping the airway open. Monitor the patient in case convulsions, cessation of breathing, or unconsciousness occur. Never induce vomiting in an unconscious patient or in a patient experiencing convulsions. This is because aspiration may occur. Also, never induce vomiting if any of these following substances have been ingested: lye, household cleaners, hair care products, grease or petroleum products, or furniture polish. In the case of these substances, vomiting may increase internal burns. Do not administer syrup of ipecac to induce vomiting. It has not been proven effective in preventing poisoning. Okay, so now we are halfway through the nursing interventions for some medical emergencies. Good job, guys! So, let us now begin with choking, either partial or complete obstruction. So, in mild obstruction, encourage the patient to continue coughing. However, do nothing else except monitor for deterioration. Next, in severe obstruction in a conscious patient, Stand to the side, slightly behind the patient, and support the chest with one hand, then lean the victim forwards. This is so that the obstructing object comes out of the mouth rather than going down further in the airway. Next, give 5 sharp back blows between the shoulder blades with the heel of the other hand. You must check after each blow if the obstruction has been relieved. So if you have found yourself in a situation wherein the previous steps were unsuccessful, give 5 abdominal thrusts to the patient. Stand behind the patient and put both arms around the upper abdomen and clench one fist. Using your other hand, grasp it and pull sharply inwards and upwards. I think you all may be familiar with the term Heimlich maneuver, and that is what we are going with in this situation. Lastly, in an unconscious patient, lower the patient to the floor. If you're outside a hospital setting, let's say you're in a community, call an ambulance immediately. While waiting, begin CPR even if the pulse is present in the unconscious choking victim. So here we are now at the dislocation. In the treatment of dislocation, it involves the reduction and the immobilization of the affected joint. The administration of analgesics for pain relief will also be necessary in the treatment process. After the reduction is performed by the physician, an immobilization device is normally applied in order to prevent further injury. As you can see in the picture on the side, those are casts, which is worn by the patient. So let us now tackle the nursing interventions for strains and sprains, both of which have a very similar treatment process. For first aiders out there, some of you may be familiar with the mnemonic RICE, which stands for rest, ice, compression, and elevation. This treatment consists of resting and elevating the affected part, applying cold, and using a compression bandage on the affected area. So for strains, specifically speaking, instruct the client to allow the muscle or tendon to rest and repair itself. He or she may do this by avoiding use for approximately a week and then by progressing activity gradually until healing is complete. Then the nurse must teach appropriate stretching exercises to be performed after healing, not during, after, to help prevent injury. And lastly, prepare the client for surgical repair in severe injury. Okay, as for sprains, as stated in the RICE mnemonic earlier, elevate or immobilize the affected joint and apply ice packs immediately. And you may assist with the tape, splints, or cast application as necessary. And same as the strain, prepare the client with a severe sprain for surgical repair or reattachment if indicated. So here we are now at the nursing interventions for fractures. First, the nurse should instruct the patient regarding proper methods to control edema and pain. For pain, the nurse may teach relaxation methods such as music therapy and visual imagery. Next, it is important to teach appropriate exercises to maintain the health of the unaffected muscles and to increase the strength of muscles needed for transferring and for using assistive devices. You may see some people wearing crutches. Those are examples of assistive devices. Next, create a plan with the patient and with his or her family to modify the home environment to promote safety. This is applied such as the removal of any obstruction in the walking paths around the house, so slight adjustments may be made in order to accommodate the patient. Wound management. Wound irrigation and debridement are initiated as soon as possible. Elevate extremity. The affected extremity is elevated to minimize edema. So this may be what is referred to during the first intervention, which is to control edema. And lastly, the patient must be assessed for presence of signs and symptoms of infection. So once they are identified, they can be dealt with accordingly and immediately. So let us now move on to the nursing interventions for shock. When you say shock, there are several different types of shock. However, the treatment for all shock states is generally the same with a few differences relative to the shock classification. The main idea is to stabilize the patient as much as possible with broad-based treatment and then target the therapies based on what is specifically happening with the patient. First treatment and nursing intervention is to optimize oxygen delivery. So the nurse must provide oxygen. Many patients will need to be intubated, but if the patient caught the shock early, the nurse may be able to give oxygen via a mask or even a high-flow nasal cannula. The sicker the patient is, the more likely they'll need an ET tube. Next is to restore volume. The nurse must give fluids and or PRBCs to fill up the bucket. Lastly, the administration of medication. This will depend, however, on the type of shock that the patient is experiencing. So the next nursing intervention that focuses on the treatment of shock is the reduction of oxygen consumption. The nurse must decrease the work of breathing, or the WOB, of the patient. If you're wondering what that means, it is the energy expended to inhale and exhale a breathing gas. The nurse must do so, or the nurse can do so, by intubating or giving oxygen to the patient. Next is to treat the patient's pain and anxiety. Third is to keep the patient normothermic. Just note, shivering increases oxygen demands, as does fever. And lastly, decrease oxygen demands with a mechanical ventilation device, sedation, or even neuromuscular blocking agents like Nimbex or Vicuronium. As you can see in the picture on the right, that is what a mechanical ventilation device looks like. So here we are now at the nursing interventions for fainting. First, the nurse must kneel down next to the patient and raise their legs supporting their ankles on the nurse's shoulders. Note, the ankles of the patient must be on the nurse's shoulders. This is to help the flow of blood back into the brain. And as you can see in the picture, there's no nurse there. However, it can serve as an alternative if the nurse is unable to raise the patient's legs up to her shoulders. Next is to check for other injuries. So while fainting, the patient may have injured themselves while falling down. So the nurse must look for other head injuries or any other wounds and treat them accordingly. One experience of mine was when we attended mass in the morning and my cousin fainted. She had an injury on her head because she accidentally bumped into a shelf. So it is important to check for injuries. Third, make sure that the patient has plenty of fresh air. The patient must not be crowded by a group of people. So for example, if your patient fainted in the middle of the street, then there are a crowd of onlookers, you must tell them to back away from the patient so that the patient have fresh air. Yeah. And if indoors, then the nurse must request assistance from someone to open a window. This is because the nurse cannot get up herself because, as stated before, the nurse is tending to the patient by lifting her legs upwards and her ankles to the shoulders. So you need to request assistance from someone. And lastly, you reassure the casualty and help the patient to sit up slowly. If the patient begins to feel faint again, then let him or her lie down again. But if the patient stays unresponsive, then the nurse must open their airway, check their breathing, and prepare to treat someone who is unresponsive. It's the final countdown to the down. Okay, so way to go, guys. You're now finally at the last slide for CLO number 6. Seizures. So the first intervention is to teach the significant other of the patient to determine and familiarize warning signs and how to take care for patients during and after seizure attacks. So they must avoid using thermometers that can cause breakage, such as those mercury thermometers that we are all familiar with when we were young, and it is less used now because mercury, the substance inside it, is poisonous. Then you may use a tympanic thermometer when necessary to take temperature. And you uphold strict bed rest if prodromal signs or aura experienced. And turn the patient's head to the side and suction airway as indicated. Support head and place on soft area or assist to floor if there's no bed. Do not attempt to restrain, and I mean it, do not attempt to restrain the patient. Monitor and document AED drug levels, corresponding side effects, and frequency of seizure activity. Next is to promote airway clearance. Maintain in lying position, flat surface. Turn head to side during seizure activity. Loosen clothing from neck or chest and abdominal areas to promote blood flow. Then suction as needed. Supervise supplemental oxygen or bag ventilation as needed postictally. And afterwards, when the seizure has stopped, you may help the patient improve self-esteem. So you determine individual situation related to how low self-esteem in the present circumstances. However, you must refrain from overprotecting the patient, and you encourage activities, providing supervision and monitoring when indicated. Know the attitudes or capabilities of the significant others, and help the individual realize that his or her feelings are normal. However, guilt and blame are not helpful. And for the last nursing intervention for seizure is to enforce education about the disease. So, you may review pathology and prognosis of condition and lifelong need for treatments as indicated. You discuss the patient's particular trigger factors, could be flashing lights, hyperventilation, loud noises, video games, and even TV viewing. And know and instill the importance of good oral hygiene and regular dental care. And you may review medication regimen and the necessity of taking drugs as ordered. And lastly, not discontinuing therapy without physician supervision, and include the directions for missed dosage. And that is all for CLO number 6. I hope you had a good day. I hope you understood anything. And have a nice day.
Good day, I am Wahing Wendeliza and I am here to report on CLO number 7. Show materials needed for first aid. Adhesive tape. This is a type of pressure-sensitive adhesive tape used in medicine and first aid to hold a bandage or other dressing onto a wound. Plasters in a variety of different sizes and shape. We are all familiar with this. This is a small medical dressing used for injuries not serious enough to require a full-size bandage. Sterile gauze pads. This is the basic tool used to stop bleeding and keep wounds clean. Sterile eye dressing. This is suitable for minor eye injuries and provides initial protection from possible infection. Triangular bandages. This can be used to treat larger wounds or as a sling to support the arm. Crepe rolled bandages. These are used to support damaged limbs or joints. Safety pins. This can be used to fix or secure bandages. Disposable sterile gloves. This can be used when treating others to prevent cross-infection. Tweezers. These are often used to remove small foreign bodies such as splinters. Scissors. These are used to cut plasters or bandages. Alcohol-free cleansing wipes. These can be used to clean infected areas or open wounds. Sticky tape. These are used to fix bandages and dressings. Thermometer. This is used to check and monitor a person's temperature. Skin rash cream. This is used to soothe irritated skin. Antiseptic cream or betadine cream. This is convenient for treating minor cuts, scrapes, and burns. This also promptly kills germs that can cause infection in minor cuts, scrapes, or burns. Pain relievers. These drugs provide relief for many minor aches, pains, and illnesses. Cough medicine. This drug provides temporary relief of coughing. Antihistamines. This provides temporary relief of sneezing, watery and itchy eyes, and running nose due to allergies. This also helps relieve upper respiratory allergies.
So that is the end of our discussion. For objective number 8, please refer to the procedure guide.